Hello and welcome. I am Dr. Anil Joshi. Welcomes you to my series that is Learn Radiology with Dr. Anil Joshi. In this series, we take different aspects of radio diagnosis and see in detail the basics and how to approach a diagnostic accuracy by reading the images. So this series is essentially meant for those who are interested in taking radiology as their future career. So also the technologists who are likely to go for the technician courses or radio physics as their career. So here we go today to a topic that is a darkroom technique. Basically, darkroom technique is the technique which was used in earlier days to develop the films, and subsequently in modern days it is replaced by a CR or DR technology. So this darkroom is a technique we should know. However, it is usually not used in most of the higher centers. However, still in small centers it is still going on and it is used. So we should know about it at least theoretically and as a historical background that how it was once upon a time. So here we go to the proper lecture, that is a detail of the darkroom, how it was, how the films were developed, how the techniques of the darkroom has got limitations, what are the advantages, what are the disadvantages, what are the artifacts produced in these techniques, how to reduce them and how to reach a perfection. So before we start this lecture, there are certain disclosures, acknowledgement and disclaimers. This comes as a part of our routine educational series. So a lot of material is coming in the department since many days. We have used it from beginning and there are various sources to which the material has come. Most of the theoretical material is from us, but some of the material is borrowed from the net, which is royalty free and which is free available for educational purposes. We acknowledge with thanks those who has contributed for that, though their names are not known. Still, we acknowledge them, and we go here with the darkroom techniques today with all this introduction. Now, this is a technology of past, as I told you. Today, it is existing in very few centers, and at present, it is rapidly replaced by CR and DR, and it was using, the technique was using, the darkroom was using developer, rinser, fixer and washing tanks. So it was really a bulky place and it was really a messy place where a lot of water was getting seepaged and there was a lot of chemicals being used which needs to be handled properly. So also all these things needs to be done in a dark room. So red light was used as a safe light since film were either green or blue sensitive. What does it mean? If film is sensitive to green light, we cannot use green light in a dark room. Same is the case with the blue base. If film is sensitive to blue, we cannot use it since the blue light will cause film to either fog. What is the fogging is something which we don't want, but still it comes on the film. That will happen and it will obscure the details which we really want. So a darkroom should have a safe light. Darkroom should have illumination so that we can work, but it should not be either of green or that of the blue. So it was usually a red color that was used. Now, the word darkroom means both the things which either overstate its or understate the causes. Now let's see how it is. The overstatement, because complete darkness is unnecessary and complete darkness will not allow us to work in it. And two, understatement, since it is not the only light but also radiation that is prohibited in a dark room. So dark room has got two roles. One thing is to prevent the light for which the films are sensitive. Number two, it should have an adequate light so that a technician can work or the technologist can work in it. And third thing, it should adequately protect the person working as well as the films from the radiation, since the darkroom is usually situated in the center of the department. Therefore, the name we suggest is the processing room rather than a dark room, since it suffices this purpose also. It clearly states also that what it does, and it really means what we are doing in the dark room, that is the processing. And this also needs a cleanliness and also certain ventilation facilities, because the persons are working in a dark room for a long time. There are certain, no doubt it is in small dose, but there are chemical fumes, humidity, so that a working condition has to be possible for the technologists who are working. Now, what are the building essentials? Now, darkroom location should be selected in the planning stage of the radiology department, because it has to be a central place. Number one, it needs specific engineering, that is the structural as well as certain specifications it has to meet, so that it will be a perfect dark room. Like the walls of dark room should contain lead, that is 1.6 mm thick, to protect both the technician and the films. Or the second is 9-inch wall thickness, which is usually preferred, but it takes a larger space. So in most of the department where there is larger space available, a 9-inch wall thickness is preferred, and at certain places where there is no adequate space, the 1.6 mm lead is used in the walls, but it goes little expensive. Now darkroom should not be less than 8, the darkroom should not be less than 8 feet long in any of the walls. So at least 8 feet should be the working space within the darkroom, because we have to have developing tank, we have to have loading, we have to have film storage, which we are going to see subsequently, and we should also have hangers which are needed for the film to hold and to proceed for a manual developing. Now, plumbing and electricity is a special attention, because there is a lot of humidity and there is a lot of wet surfaces. So there should be proper earthing, there should not be proper earthing. Then electrification needs to be properly inspected, visualized, rectified time to time, and there should not be any leakage through the electricity circuits, nor there should be proper earthing, so that the electricity shocks will be prevented. The plumbing is because it continuously needs a running water. So if this is hampered in between, we will get what is that is the stagnation of water, which will result in a bad quality films. Now here we are seeing a pass box. The classical design of pass box is there are two compartments. One is called as exposed films and another is called is for unexposed film. So what is the role of this? Only at a time, as you can see the latch, one side can open. So if you are opening one side, the other side will not open. This is one. And second thing, which is that other side, is towards the darkroom side. Now this pass box is fitted in such a way that one of the doors are outside in a daylight, where the X-rays are taken and the cassettes are loaded, while the other end is situated inside the darkroom. So if at all there will be such an incidence that both the doors will open, the outside light will go inside the darkroom and all the films will get fogged, whichever are being processed. So there is such an arrangement that at a time either an outside technician can load it and inside technician can take it. At the same time, once the cassette is taken inside, the film is taken out, the film is put in a developer, the cassette needs for a recirculation. So it needs to be sent back. So this is done with the help of another side, which opens from the darkroom. A technologist puts the cassette inside and the outside technician takes it out, but at the same time it is clearly as specified, at a time only one door is opening. Now this is an ideal pass box which I had described. Now these are the two darkroom which are showing internally. Internally, though it's a darkroom, it should be clean, nice and well organized, because most of the technicians are working in the dark. So they should not search the thing. It should be handy. Not only handy, a flowchart should properly be maintained. Like a cassette is drawn from the pass box, that is exposed cassette. It is taken on the loading desk. On loading desk, a cassette is opened. The film is taken out. It is put to the hangers, and A hanger is dipped into a chemical, that is, first is developer, second is a linser, then is a fixer. It goes according to the time and as per specifications, and also depending on the temperature, because it's a chemical process which is very sensitive to a outside or surrounding temperature. Let's go to the next point. What are the paint essentials? Now, is it that the darkroom should be really should not be painted or should be left? No, it's not a fact. The darkroom needs to be painted with black color. Black color is because it should not be a reflecting surface. There might be a small leak from the walls, from the pass box, from the safe light, or from any other sources like exhaust fans. So if the light comes inside, if it falls on suppose a white surface, it will get reflected. So that is something which we don't want. So for that reason, a darkroom preferably color with black. But if it is painted with black, then the visibility inside is really difficult even with the help of safe light. So the wall should be covered with varnish or lacquer chemical resistant, because all these chemicals like developer, fixer, or maybe a water which is used for washing the films also contains some amount of chemicals. So this water gets seepage or this gets spilled on the surfaces. So usually the external surface where the tanks are is with the glazed tiles which are acid resistant also, and which can be washed easily and it can be kept clean. Now floor should be covered with non-skid or the non-skid tiles. Reason is very simple. In processing, there is a lot of seepage of water which drops on the floor, so there should not be a skidding or such type of accidents, because we really work in the dark when the visibility is not as good. Now, one thing I told you was a pass box by which a cassette can be put inside. Now, second method is a technician carries the film along with him in the darkroom itself. So here we are shown a gate which is something like a C-shaped gate, of which it can open outside. In that C, the technician enters, it rotates so that the open surface goes inside the darkroom, but the outside surface is covered and there will not be any seepage of the light. So this type of entrances are not a very common thing in a busy department. The reason is it takes a long time. Instead of that, a pass box does a better work and it is a faster work for a busy department. This is the only type of door? The answer is no. There are other different type of doors which are called electrically interlocked doors. Then second are the maze that is zigzag. When there are 3 walls, 1, 2, 3, and from that you have to go and the light gets blocked, as you can imagine it how it will be. Then third is a simple single door made of light-proof material. Sometimes even the curtains are used by certain people, but it's not a very ideal and very safe. A pass box is one of the best technique which can suffice the work also. So also it can expedite the work, it can give a flow chart, and a technician really enjoys working inside and outside because they do not have to travel through the trap, maze, or through the rotating door, which are really cumbersome to use. Now this darkroom, once the technician goes inside, stays there for a long time. So is it that the darkroom should be just something like a pack all side, no ventilation, no windows? No. A good ventilation is required. As I told you, there are certain fumes from the chemicals. So also there is a high humidity inside, and especially if there is high temperature, to work there for hours together is really tedious. So air conditioning is the best solution. However, at many places due to economy, exhaust fan is used, and it has got a peculiar arrangement so that when exhaust fan is on, the light will not enter from outside to inside. It is protected by means of a tunnel which is 90 degrees turn inside and outside, so that there will not be any light coming, but the air can go inside and outside. Now exhaust arrangement has to be made in such a way that all the air will get replaced and fresh air will be pumped in. Now another thing in the darkroom is a safe light. Now, illumination allows people to see a developed film but will not cause a film fog. So it suffices the work of visibility. It gives a low visibility, but there is a visibility. Because of that we can work. Otherwise we cannot take out the film from the cassette, we cannot put it to the hanger, we cannot put it to the developer, we cannot develop film into fixer. So there has to be a visibility. That is number one. So for that a safe light is provided. What is the meaning of safe? The light should be safe, not to cause harm to the film, but it should give some visibility to the people working inside. So that is the basic aim of the safe light. So safe light has to be there. Usually it is red color because films are not sensitive to red color, and films are sensitive to green as well as blue base. So a safe light has to be red color. Safe light has to be a safe. That means it should not cause a fog, that is wanted blackening of the film. Then for that reason you have to see appropriate filters are used. So also a bulb of not exceeding 15 watt is put up. The working distance from the safe light should not be less than 1 meter. So if the safe light is put at too close distance, okay, visibility will increase, but no red light contain only red light. It contains certain other shades of light also, and if that is the case, they will cause a untoward effect over the film, because film is sensitive to blue and green. Now let us continue with the further safe light. Then it should be minimum of 3 feet from the working space. I told you it should not be less than 3 feet, means it has to be more than 3 feet. Then filters can crack, so must be checked. A time to time visual inspection as well as inspection with the help of the techniques which I am going to tell you later on has to be performed to know that safe light is really a safe. Now here we have shown a safe light. We have shown the distance is more than 1 meter. Below you are seeing the hangers. And above is the safe light. Okay, you have got a darkroom where there is safe light. Now you want to check it whether the safe light is really safe or not. If it is not safe, then there will be film fog. So how to know if safe light is not efficient or safe light is not safe is by knowing the fog. Now, if we are finding that there are certain fogs on the film, that is certain untoward shades, gray shades on the film, we have to perform a check whether the safe light is really safe or not. There are different methods and different types of checking it. The type which we use is by using a small dental film. We keep it in a safe light area after that or more than the distance of 1 meter and check it at the end of 2 or 3 minutes. We develop the film and check. Now you are seeing here gray shades. The extreme right side is the white and then are the gray shades. You should not get the extreme gray shades. You should get something in between these two. That also as far as possible should be avoided, and best if you get first white or next to it. And usually it can be achieved. It is not that difficult to achieve, but provided we know it, how to achieve it. Safe light, we have to seal the punctures or leaks. We have to see that there will not be leakage. Check the bulb whether it is more than 15 watt or not, and also the distances at which the people are working. It is also okay if your darkroom is more than 8 feet, you can use 2 safe light, one for the loading desk and one for the developing desk. Then there has to be a general illumination also, not because when we are working in a dark room developing the film, not for that purpose, but the overhead light is required for general maintenance and cleaning. The darkroom, when not in use, needs to be cleaned, especially for the spillage of water, spillage of chemicals. Then if there is a dust, if there are any other impurities coming inside, like this because of the dust and all that thing, if it is coming inside, then we'll have to check it and we have to clean the darkroom, and for that we need also a routine light which is not used when we are doing a film developing work. Then coming to a fluorescent light to view wet films. Now here we are seeing it, how the tanks are. The developer is the smallest. For simple reason, more frequently you change the developer, better it is. Because developer has got a life. If it is exposed to light or it may be getting exhausted, then you get a bad contrast film, or sometime the film after a few days gets orange colored. So for that reason, you should have fresh developer, means best if you have got a small capacity developer. Versus the rinser has got no problem, it can be used, it doesn't have a life expectancy. And third is a fixer. Fixer also, as far as possible, it should be changed in a certain duration. If you are making it too long, then the films take too long to fix. Number one, they get sometimes non-fixed properly if they are urgently removed. And third thing, films for preservation are not good, because after a few days they get brown or orange. Coming to tanks, whether a tank should be kept open in the air or they should be immersed in the water, yes, it depends on the temperature of the places. Places like our places are very hot, so it is better to immerse them in a big water tank. So there is a big water tank in which there are submerged a tank of developer, rinser, fixer, etc. So it maintains the temperature in proper ways. Otherwise, the proper design is shown here where there is flowing water around. So the flowing water keeps the temperature at a certain optimum rate. So that is the advantage of having a running water around the developing tray. You are informed that a technologist has changed developer fixer, and now you want to proceed towards the routine work. So what you check first is the tank level. Then the tank level has to be maintained. Out of the three tanks, that is developer, fixer and rinser, as far as developer is concerned, it receives a dry film and it puts out a wet film. So always there is some loss of water or some loss of developer along with each film. So the level of developer every day goes down. Second is the rinser, which doesn't have much meaning. It can be in either way. Fixer receives a wet film and puts out a wet film. So ideally there should not be any change in the fixer level. But usually because of the large volume, the films are not properly drained. That is, they are not allowed for the fixer to get back to the tank. So certain more fixer than what is surface layer goes out and level of fixer goes down. So these need to be checked. So also these needs to be rectified. And that has to be done every day morning, and then only we can start the work. Now how much to fill is a very simple thing. We usually use a hanger. You put the hanger that is without a film in a developing tank. See that the total hanger where the films are clipped goes down to the water. So that is most important and very easy to check. Now second is to check the tank temperature. Sometimes it is technically difficult for two reasons. One thing is you can check it in the morning, evening is okay. But when the working is going on, it really hampers, number one. And number two, there are a lot of water is flowing, new water is coming, old water is going. Technically it is a difficult thing, but ideally you should check the temperature. Then before developing in the morning, you have to stir. Or if your department is working 24 hours, then stirring is essentially not required, because continuously film are getting processed, whether day, night, Sunday or otherwise. So if there is a small gap of two working times, then you have to stir the chemicals. And it goes without saying that developer pedal and fixer pedals should not be mixed, they should be different. So that has to be properly done. So after these things, you are ready for a development of film. What to do next, or what is the next step? Place the film in an appropriate size hanger. So once the cassette is received in the darkroom, you open it. There is a peculiar method, typical method how you should open the cassette. the front side of cassette should always be touching the desk, and the behind it should remove the clips, and you should again turn the cassette so that the film will fall on the back surface from which you can easily remove it. Once you remove the film, you can clip it to the hangers. Now it's a good technique you acquire as the time goes, how to remove the film from the cassette in a quick ways. Then the small clips of the corner are opened, film is put, and films are clipped again so that full hanger hold a straight film without any wrinkle. Now this button needs to be checked, and whenever required you have to repair them, or you have to just press them so that they will catch the film or hold the film properly, and then develop it. Now silver halide crystals are reduced to a metallic silver. That is the development process. Now for that, you put the film, start the timer, agitate the film to dislodge air bubbles from the surface. So what is the agitation is to just take out film by 5-6 inches and put it back to the developer. Why you should do it is, there are two things. One thing is that every time there will be new developer will come in contact with the film, number one, and number two, there can be trapped air. Trapped air will get removed with the help of this agitation. And third is, what is the time required for developing and fixing is absolutely depending on the temperature, how old is your developer, and what are the working, how many films you are developing per day. In the morning, suppose if you are having a big workload, by evening your developing time will go high. And the temperature chart needs to be maintained in whichever way it is possible, but in most of the department where we work, we do not have these temperature charts. Now these are the developer fixer, how they are shown, their tanks, how they are filled, how they are drained, and here there is importance of drainage as well as electrification. Now what are the constituents? That is hydroquinone and metollenone. Then there are preservatives. In what are the preservatives is in sodium sulfate. It protects from oxidation and decomposition of the products. That's why a developer need to be made freshly. You have to make developer freshly and frequently. And once after a couple of days, you have to replace them. You can use it. You cannot use it too long, even though there is a low workload for the film. Then there are some accelerators which will enhance the speed of development. That is the sodium carbonate, hydroxides, and gel swell and alkalinization. So these are the things which will accelerate the process, and these are the compositions of the development. Once you have adequately time kept a film in a developer, agitated it fairly, sometime you can get it with the help of safe light, how much film is developed, and if you have got really good eye, you can really appreciate the totally developed film. So once the film is totally developed, you have to pull it out and put it in the rinser. Rinser, it has got it changes the pH. Usually it is acetic acid. It changes the pH from base to the acidic because the fixer is acidic and the developer is base. Now, once you take out the film, you put the edge to the tank so that most of the chemicals which are on the film, that is developer, will get back to the tank and will not get to the fixer, because both, I told you, are having different pH and they will dilute each other. Acetic acid is used as a rinser, which not only removes the residual developer but also changes its pH. Agitation and wringing, rinse about 3 seconds. Remove the film, allow it to drain, rinse it again and put it to the fixer. Here we have shown how a rinsing. Now you can say that from developer, these are dental film in the holder. So there are multiple metal films from developer. Now they are going into the rinser, that is in between tank, and from there it will go to a fixer. Now coming to a fixer, the technique of fixer is a casual, means there is no time limit as strict as that of developer. Usually it takes double the time that of developer, but even if you keep it for a longer time, there is no problem. Agitation is must for two things. One thing is every time a new fixer will come contact it with the film, and second, the air bubbles. Air bubble will get removed. Otherwise, if the air bubbles are large, after you get film developed, after a couple of days, the mark will be seen on the film because it will change in different color. So, once you are in a fixer, once you are fixing the film, by no cost, film should go back again to a developer. From fixer, it has to go to water and water only. Because if you do other way, it will not only damage the film, you will not get any results on it, but you will damage the developer also. So you have to put it from fixer, it has to go to the washing only. One of the basic aim of fixer is it stops the further development, and the preservatives are there. They allow film for a larger storage. Film should not change its color, it should not fade, or the contrast should not deteriorate. All these things happen only when you got good quality developer fixer. Not only good quality, the temperature is maintained. Not only temperature, proper agitation is done. Not only agitation, but proper rinsing, developing time maintained, fixing time maintained, and properly it is washed by the water. So these things are very, very important. Now, another thing of the fixer is to remove what are the excess chemicals that is remaining on the film. The fixer has got 2 preservatives, then 3 it has to have preservative, 3 it has to have hardener, that is chrome alum hardens gelatin and protects from scratching. Now these all things are important when you are going to preserve the films for a longer time. So there is a gelatin layer. That gelatin layer needs to be hardened so that it will become there will be less scratches. And as far as glaze is concerned, films will be more glaze. It will have more glaze. It will have less scratches, and it will be preserved for a longer time. It will form a proper protective layer. Then the acid neutralizes alkalis. That is optimum media for fixer and hardener. So this is another basic behind all this processing. Now washing is important. Washing has to be done in a running water. Now, how many cycles of water should be there depends on your water tank capacities. It cannot be really mathematized. But by and large, we keep a small flow of water through the water tank. Now, roughly 10 times of the water tank capacity should get replaced per hour, but this is not measured, it's an approximation. And usually we know it once the washed film comes out. If it is not properly washed, we can make out. When it is brought out, we again say that washing needs to be proper. Either you change or put this again and wash it again, or you see that the water flow is increased or the water has got too much contamination. So drain all the water and fill it with fresh water. Now, it doesn't matter if film is kept in water for more time. Don't worry about it. It is better if you can keep it for 15 to 20 minutes. And most important thing is to remove excess water, because water do stain films. So proper washing has to be there to give a good quality film. So also to help its preservation. Into drying. Now, for dryer, it is easy, but at many places there are no dryers. What is done there? They are kept on a hanger and there are some fans over it. If the room temperature fairly high, as most of the places in our country, we do not need any heated dryers. But heated dryers are preferred in a busy department since it can reduce your time. So these are the big cabinets where the room temperature is high and there is dry. So the dryer will dry films quickly, number one. Number two, it will prevent film from getting retained water over the film for a longer time. Now, excess drying can cause cracking of the emulsions. So there are two disadvantages. One thing is can crack the emulsion, number one, and two, the whatever is a polyester base can get wrinkled. So dryer should have proper temperature. Film is never touched while drying. We can make out by looking at film whether it is dry or wet. There is no need to touch it. And if you touch it, there will be an artifact or fingerprints over it. And then only properly dried film is useful for storage. Most of the time what happens is because of the hanging, the water comes at the lower portion and somewhere at the edge there remains a water drop, and when you keep all films together, that water will spoil all your earlier good work. So it has to be meticulously maintained. Now, what are the types of processing? One thing is manual, what we had discussed for low just now, but it takes a intensive labor. It is time consuming. It has got more maintenance. It is messy, and most important thing is you can have low turnover with it. So if you have got a department where the turnover is high, where you need more number of film and less number of time, you have to have automatic processor. Now, all steps of manual processor are mechanically performed. So there is not much as far as chemical reactions are concerned between automatic and manual. Then maintenance is easy. There is no rinsing in automatic processor. From developer, film goes directly into fixer and directly goes into water. The processing time for manual is between 7 to 10 minutes. However, in automatic processor, you can reduce it to 90 seconds or also less depending on the departmental workload and demand, and seconding is capacity of a processor. The radiographs are of consistent quality because the chemicals are recycled and rotated in more proper ways, and there are less artifact because the process is properly monitored, properly timed, and there is rinsing, cleaning of the film is done in more meticulous ways by the rollers. The next question is how it works. How it works? It works because of the higher temperature, there is a rapid processing. So it has got built up heating elements. Then feeding tray, there is a roller. So every time there is a buzzer, every time there is a signal, and you can load films as per the timer and as per the demand or as per the signals you receive from the machine. The roller system takes film to each tank in very specific time which is consistent. Then time spent in each tank is determined by the settings of the gear and speed of the motors. Now both the things can be monitored manually, automatically. So you can set the timer in such a way that you know how long a film will remain in developer, how long a film will remain in fixer, and how long will be a total developing time from putting film in to the out. This can be monitored, and this is usually governed with the help of temperature. It gives you a properly dried film, and chemicals replenishers are added or replaced every time depending on your calculations. So there is a fixed measure as how much is the developer required per film, how much is the fixer required, and accordingly it is replenished. So every time you get consistent quality and strength of the chemicals. Now here it is shown a developer, then fixer, washer and dryer. Now you will appreciate here that there is no rinser. Rinser is not required. It is not there in automatic. And one of the most important thing in a busy department, when you are developing films one after another, you should know what is the patient's identification. So what are the identification and why they are required? They are required for medical legal purposes, then they must be in emulsion itself. You cannot, if you write it later on, then it will not have much meaning medical legally as much as if it comes from the emulsion itself. If you write it afterwards, no, it will not have much value. It will account to the tampering. Now, hospital and doctor's name sometimes are there, sometimes they are not there. Patient's name, sometimes there are name, sometimes there are initials, sometimes there are date, side marker and number which can be decoded later on. Then there is radiographer's name. Usually name is not there, but everybody is given a symbol like ABCD. So suppose a technician takes a film, his A initial come in all the films which he has developed or which he has taken of the patient. So till end it goes along with his identification mark. Date has to be there. Without date and without side marker, film doesn't have any meaning. Now, how identification are achieved? It is by the lead impregnated tape. So, as far as hospital name is concerned, it's available. That is commercially available. As far as side marker is concerned, yes, you got right and left. As far as numbers are concerned, fine, there are different numbers which need to be written. So, there is information written on the tape and then placed on the cassette. Then lead identification markers are there and makeup of stick on the white tape, put on the cassette in the corner, which will not hamper the area of interest. That is most important. Where to put a marker is a skill of a technician and is fairly consistent of all the departments. You cannot put it on the area of interest. Now these certain things are shown here. Now storage of films. Storage is for both. One thing is the fresh films which are not used, and second are the used films or patients identification. Storage of both is extremely important. Now you will have to store properly the films, especially new packets, how to keep, where to keep, and all that things. Unless you keep it properly, your film will not remain properly. Now they had to be in organized manner. There has to be a label, there has to be envelopes, there has to be color code, and there needs to be numbered. Now coming to a good technique and bad technique. A good technique, good well developed film, well fixed film, well washed films, good identification, good side marker, good hospital name, good patient's name, and everything is perfect. You can store it as long as you want. Nothing will happen to it. But right from the storage, right from the transportation, right from the putting it to the cassette and removing it, if it is done wrongly, you will get artifacts. Now, what is an artifact? It is a part of the subject, or it is a part of the thing which is on the film, which is not in the subject and which you don't want. Now, this can be introduced, or rather this can come from bad handling, bad storage, or during the exposure, or during the development. So during the processing time, during the storage time, during the handling time, during the transportation time, everything is important, and including a place where you store a large number of films. They are unwanted and they often cause more problems because they need to be interpreted, and they should not. Sometimes the artifact look like a pathology, and here the real skill comes. And they are distracting, they are of no use. There are certain artifacts which are going to discuss. There are n number of artifacts, but let us see some here. The first is the static. Static is the rapidly pulling the film from the box of the cassette. Static, as we really experience, is in winter season when we sit on a plastic chair and we try to get up, there will be some static. That is the electricity produced. So these static electricity marks can be there on the films. So that happens when there is a rapid movement. Maybe while putting in the box or pulling from the box or pulling from the cassette, they can come. Then because of low humidity, they are worse in winters. As I told you, the static mask when we get up from the plastic chair. Right? These are the certain things which cause the artifacts. And which are the types of artifact? There could be like wool clothing, they could be like a screen cleaner, or they can be like trees, they can be like lightning. So these are the few artifacts, really few, because there are a lot of things every time different, and they can come anytime which we just don't want. And we come to know at the end of all the procedures, and then we'll have to repeat the film. Now, what is a fog? Again, we are going towards the same. There is a chemical fog, number one. Light fog, that is a light leak, safe light crack. Then scattered fog, that is film left in the room, or storage fog, outdated film and darkroom at a high temperature. Till now, we have seen different darkroom techniques. We have seen how a darkroom should be. We have seen how to make a real darkroom room. As also we have seen what are the factors required when designing a darkroom, where to design it, where it should be, what should be transportation in and out of the darkroom. And also we have seen if we do something wrongly, may not be intentionally, but maybe because of out of ignorance, how to identify, how to rectify them at the end of the day. That we have studied. We have seen also certain artifacts. We have seen also how to check a safe light. A safe light has to be safe. We have also seen even a dark room is there. The person who is working in the dark needs to be ventilated properly. He needs to be considered as a human being, and his working condition has to be proper. So there has to be proper air conditioning, proper ventilation, the proper temperature. We have seen manual processing, automatic processing. Now with all these things, the historical aspect of darkroom we are completing. I call it historical, but I know for how many years it was an important thing in diagnosis of patient. It has made millions of diagnoses and millions of people better. So though it is outdated, though it is old now, we should know it to acknowledge it. With this, I thank you for giving me your valuable time. Please note, radiology is not a race, it's a process. Be a part of this and enjoy the feast of knowledge. I, Dr. Anil Joshi, logs off till we meet again. If at all you have got this type of darkroom, try to make knowledge of these and give best of yours so that the patients can be benefited. Thank you.